There is one area of nursing that I believe most nurses have never considered moving to, and this particular area of nursing is leadership. The first thing that comes to most people's mind when they hear nursing leadership is unit managers or nurse managers. That being said, there are so many different areas within healthcare where nurses are able to take up leadership positions. The skill sets, experiences, and knowledge that nurses possess lend themselves very nicely to mid and senior level leadership positions. Some, not all of these positions, will require further education. However, it could be a worthwhile investment, particularly if you are starting to feel burnt out and you do have a passion for improving patient outcomes. A lot of individuals believe that only those with innate talents are able to aspire to leadership positions, but that is a notion that is patently false. The truth is that, like any other skill, leadership is something that can be learned with time, effort, and consistent practice. And so today, we're going to talk about 3 reasons why you may want to consider moving off the front line and into leadership. Reason number 1. Stepping off the front line can immediately reduce or resolve feelings of burnout. After dealing with constant staff shortages, overbearing nurse managers, disrespectful patients, angry doctors, as well as everything that went on with this global pandemic over these past 3 years, it's no surprise that nurses want to leave the profession for what they believe may be greener pastures. Furthermore, working with patients day in and day out, particularly in these difficult and challenging times in healthcare, puts you at greater risk for vicarious trauma. The Vicarious Trauma Institute defines vicarious trauma as indirect exposure to trauma as a result of a first-hand account or narrative of a traumatic event. While nursing leaders may not be totally isolated from situations that could expose them to vicarious trauma, because they're a few degrees removed, there is greater insulation from it. And that insulation may be just enough to help reduce or even resolve feelings of burnout and allow you to continue working in the profession while improving patient outcomes and the lives of those that you lead. Which takes me to reason number 2. Nurses in leadership can play a significant role in improving outcomes for a larger number of patients. Let's say that you're working as a nurse on a medical surgical unit. You may have 1 to 4 to 6 to maybe 8 patients depending on the level of acuity and the staffing levels. But it begs the question, how much impact can you really have on the outcomes that a patient experiences when you have 7 other patients that you're caring for over the course of an 8 or 12-hour shift? While ICU and pediatrics tend to have lower nurse to patient ratios, it's also true that the number of lives that you can impact over the course of a shift is also lower. This is where the beauty of nursing leadership comes into play. As a leader, you'll be presented with opportunities to participate in policy changes, in procedure changes, as well as quality improvement initiatives that are designed to improve the outcomes of a large number of patients. Furthermore, you'll also be presented with many opportunities to improve the working lives of those that you lead. With the right resources, planning, and systems in place, leaders in healthcare or elsewhere are well positioned to improve the work environment for those that they lead. A 2013 systematic review of the literature by Wong, Cummings, and confirmed previous findings that there is a positive relationship between relational leadership styles, patient satisfaction, and improved patient safety outcomes. They found that a relational leadership style correlates with lower patient mortality, a reduction in the number of medication errors, reduced restraint use, and a decrease in the number of hospital-acquired infections. When you see that the work you're doing is actually producing results, that is going to bolster your self-esteem, your self-image, and your self-confidence, and will hopefully reignite that passion that some people may be losing for the field of nursing. Now, before I go into this 3rd reason, I want to thank you guys for watching the video so far. And if you are getting value out of this, go ahead and hit that like button and consider subscribing. And if you are subscribed, go ahead and hit that notification bell so that you can be notified as soon as the newest videos drop. And now for reason number 3. As a leader, you have the ability to introduce process and culture changes that can lead to a more supportive work environment. In my opinion, burnout is fueled by the vicious cycle of people leaving an area or the profession due to continuous feelings of being overwhelmed and under-resourced, and then those who remain in those areas feeling increased burnout themselves due to the short staffing that results from people leaving. And while leaders have no direct control over whether or not people stay, they do have the ability to foster an environment that makes that more likely. Let's consult the literature again to see how this works. A 2010 systematic review by Germain and Cummings found that nurse leaders who prioritize their staff are rewarded with increased nursing performance and, by extension, positive patient outcomes. One of the studies that the systematic review looked at, a 2007 study by Kramer et al., found that nurses felt that supportive leadership behaviors resulted in healthy, productive work environments that enabled them to perform better. When people are working in a healthy environment that supports, encourages, and equips them to perform better, then morale rises, confidence and competence increase, and these work to counteract feelings of burnout and stress. In conclusion, leadership is a great but seldom considered area of nursing that could be the key to you overcoming burnout and keeping yourself in the profession. Always remember that you do matter. You, yes you, have value to add, and there are lives that you can impact in a way that no one else can. So keep your head up. Thanks for watching. We'll see you in the next one.